We are a group of Master of Science in Nursing students at Regis College, and today we'll be talking a little bit about Dorothea Orem, nursing theorist. Dorothea Orem was born on June 15, 1914 in Baltimore, Maryland, just 1 month before the beginning of World War I. Her father, Benjamin, was a construction worker and provider for their family. Her mother, Adelaide, stayed home to care for Dorothea and her older sister, Monica. Dorothea spent her life pursuing work and education as a nurse, and her sister, Monica, also stayed within similar industry and joined the Medical Mission Sisters. Monica actually ended up teaching science in a nursing school in India for 20 years. The education and work of Dorothea Orem is described as exemplary. Dorothea achieved her diploma in nursing in 1934 from the Providence Hospital of Nursing in Washington, D.C. 5 years later, she received her Bachelor of Science in Nursing Education degree from Catholic University of America in Washington, D.C. During this time, she worked as a pediatric and adult medical surgical nurse and a supervisor in the emergency department. Less than 10 years later, in 1945, Dorothea went on to achieve her Master of Science in Nursing Education degree from Catholic University of America. She spent 14 years teaching at the Providence School of Nursing, where she studied, and worked in quality assurance for the Indiana State Board of Health. In 1959, she returned to the Catholic University of America to serve as an assistant professor until 1964, then an associate professor until 1970, and the dean of the School of Nursing in 1965 and 1966. Dorothea identified her theory of nursing as an answer to why nursing is needed. She published a book in 1971 titled Nursing: Concept of Practice. This helped her develop self-care deficit theory, defining the need for self-care being greater than the care available for the patient to give themselves at that time. Dorothea officially retired in 1984, but she continued to work in consulting and lecturing while still developing her theory. In 1991, the International Orem Society for Nursing Science and Scholarship was formed in Missouri to continue the development and education of her theory. In her final retirement from work completely, Dorothea moved to Skidaway Island near Savannah, Georgia, where she later died on June 22, 2007. The development of Orem's theory has some historical influences. We start off with the Great Depression. In the 1930s, many nurses in the area were employed in private duty, and they ended up finding themselves jobless due to the economic impact of the war of the Great Depression. This, in combination with the increasing technological and clinical demands of patient care and increasing needs for intensive nursing, by the mid-1930s, there was an increased demand in hospitals for trained nurses rather than nursing students. Then we move to World War II. Nursing school enrollment actually increased at a rapid rate during this time. However, most involved were in diploma schools rather than community or four-year colleges. Also in history, nursing was seen as, quote, woman's work. Orem disregarded this notion, and she ended up pursuing, as said before, advanced degrees in her craft. When Dorothea became a nurse in 1934, as said prior, she got a certification, which at the time was actually considered an adequate education for the position. Because nurses back then were viewed as an administrator of the doctor's protocols, which now we know have advanced quite beyond that. Philosophical underpinnings. Central philosophy of the self-care nursing deficit is all patients want to care for themselves, and patients can recover more quickly and holistically by performing their own self-care as much as they are able. Philosophy of modern realism. The ontology of Orem's theory is thought to be based on modern realism. And this philosophy reflects Orem's view regarding the nature of reality and the nature of human beings. Based on the philosophy of modern realism, Orem's view of the nature of human beings is that of dynamic unitary beings engaged in an ongoing process of development, striving for their self-ideal and possessing uniquely human qualities such as free will. Orem has actually denied that any particular theorist provided the basis for the self-care deficit nursing theory. While she has expressed interest in a number of theorists, she only references Parsons' structure of social action and Varbertinary's system theory. Development of theory. Historical and philosophical influences on Orem's theory. Based on the central philosophy of self-care, over the course of 5 decades, Orem refined the description of nursing to empower patients and their families to care for themselves and clarified the role of nurses in situations where self-care was not possible. During and immediately following the Great Depression and World War II, that demand in nurses in the workforce increased, and the goal was improving nurse education for more autonomy. And during this time, Orem devoted herself to working with nursing students, as she believed the value of nursing actually began in the classroom. And while working for the Indiana State Board of Health, Orem became aware of nurses' ability to do nursing, but their inability to describe nursing, and she felt that she could not improve the practice without understanding it. So her initial effort was actually to define nursing. By the 1970s, Orem believed patients needed to be treated as people and that medical histories, as well as families and friends, actually played a bigger role in treatment and recovery. And this thought actually contributed to the foundation of her theory that humans are unitary beings. So this is where we get to the actual theory, Orem's self-care deficit nursing theory. So the self-care deficit nursing theory posits that self-care is an essential human task to maintaining autonomy and well-being, including managing potential and actual health problems. Moreover, humans are driven to actually take care of themselves through self-care activities. And according to the self-care deficit nursing theory, when the need for self-care outstrips the patient's own capabilities, nurses can actually deliver care in a way that empowers patients rather than doing for patients, and help them learn and become motivated to engage in their own self-care. It is with that human-to-human exchange that the self-care deficit nursing theory is applied. Orem's theory actually applies to all. So although we think of children by definition as physiologically and functionally dependent on caregivers, the self-care deficit nursing theory and its premise that self-care and its attendant motivations can be learned was actually designed to include children and has been found to apply in this population, particularly those afflicted with chronic illnesses. Thus, nurses can support children to learn and perform self-care activities that foster their own health and well-being. Orem's theory also served to elevate nursing and clarify its role among other roles in healthcare. This is where we get into the meta-paradigm concepts in Orem's theory. The nursing meta-paradigm consists of 4 key concepts: nursing, health, patient, and environment. Nursing is seen as an artful discipline that assists patients with self-care activities who are not able to perform these activities on their own due to disability or disabilities. The nurse uses expertise to act as a liaison facilitator between the physician's orders and medicine and the patient. Health is defined by wholeness in both structure and function. Individuals operationalize health through self-reflection. Groups operationalize health by their ability to communicate with each other. Humans, or in this case we're talking more specifically about patients, are the recipients of nursing care. May they be adults or children, individuals or groups. The central actor in the theory, assumed to be driven to take care of themselves, can reflect upon their circumstances, assess and communicate needs, and affect change upon their lives. And the environment has multiple dimensions: physical, chemical, biological, and social cultural. Orem's theory contains 3 nested theories. The first being theory of nursing systems, which is the outermost, describes the nature of the contract between the nurse and the patient, or the legitimate nurse and the client. The theory of self-care deficit describes when nursing becomes necessary for the patient to maintain health and autonomy. And theory of self-care describes the nature of the actions that humans take to maintain health and well-being. For example, self-care. And there are 3 systems within the innermost circle: the wholly compensatory system, the partially compensatory system, and the supportive or educative system. So the wholly compensatory system is activated in service of the most compromised patients, so those who are extremely dependent on care for everything. The partially compensatory system is that intermediate need of nursing. An individual may be able to perform some self-care activities, but a nurse may really need to support them with or to perform activities for the patient. And then the supportive educative system is that nursing guidance and or education to achieve adequate self-care. So here is just a closer look at what that theory looks like. And then within it, you see those subcategories of the fully compensatory, the partially compensatory, and the educational system. So we think of those being within self-care, and how can we help our patients become more independent in their own care and get them to that educational stage. The concepts in Orem's theory would be self-care, self-care requisites, therapeutic self-care demand, deliberate action, nursing system, and products of nursing. So in self-care, these are activities that function deliberately to maintain what is needed for life, growth, development, and overall integrity. Self-care requisites, activities that humans engage in to control external variables so that self-care can occur. These are the prerequisites for self-care. Therapeutic self-care demand, the nurse performs her duties to therapeutically meet the patient's demand for assistance with self-care. Deliberate actions, efforts directed knowingly towards self-care or dependent care goals. The nursing system, the need for nursing care, a system that is activated only when a patient's self-care needs are greater than what the patient can accomplish on their own. And the nurse becomes the legitimate nurse and the patient becomes the legitimate client. And the products of nursing. So the self-care deficit nursing theory actually has two products of nursing, one being the care plan and two being the nursing system, once the need for nursing has been demonstrated. Like seeking medical care, understanding the nature of your illness or condition, carrying out treatment activities, adapting to changes in one's concept of self-related to disease process. And we also talk about the universal self-care requisites common to all humans, like oxygen, food, water, activity, rest, social needs. Developmental self-care requisites, like the necessity for growth and development. Health deviation self-care requisites, so those associated with deficits in the patient's health, like seeking medical care and understanding that nature of the illness. So here is the interrelation of concepts and subtheories based on Orem's original diagram. So you see the inner circle now includes what's actually needed for this patient. That's self-care, the self-care requisites, so the universal, developmental, and health deviation. And then we're also adding the meta-paradigm concepts of nursing humans, which are the patients and the health and environment. So when we talk about Orem's theory and the different meta-paradigms within the theory, it really means nothing unless it's useful in our practice as registered nurses. So this theory can actually be used in our practice in education and administration by enhancing patients' autonomy. Because the theory calls for patients to aid in their own healing process by maintaining independence over their own care. Similarly, nursing institutions such as Regis College, where we as nurses are studying for advanced degrees, have actually embedded this theory into their academic curriculum. And they use it to educate their students on interventions they can possibly use on their patients using Orem's theory. For example, if you apply this theory to a hypothetical patient case, a 59-year-old STEMI patient is attempting to brush his teeth, and the nurse uses the self-care deficit theory to motivate him to brush his teeth by himself instead of having the nurse perform the task. Evidently, this will cause the patient to increase or improve his autonomy, and according to Orem, will improve his overall outcome. And here we are putting Orem's theory to the test. So, researchers at the College of Nursing at Texas Women's University actually studied the relationship between the self-care deficit theory and children's self-care behaviors because, as I said earlier, children have that inherent ability to have that self-care deficit from birth. We're constantly helping them to learn new ways to take care of themselves. They were actually able to use databases and analyze the behaviors of over 2,000 school-age children. All 15 of the studies in the research used the self-care deficit nursing theory, and the researchers were actually able to conclude that the self-care programs based on the theory can cause children to improve self-care behaviors such as self-efficacy and self-management. And the theory's level of complexity. So the Orem self-care deficit nursing theory is a grand theory. Hence, it is a complex theory that covers a vast range of nursing topics. The theory itself is simple, but because of the numerous layers and complexities that focus on the 5 ways nurses can promote their patient's own self-care and essentially autonomy, it does make it a complex theory. So, what is the value of this theory when extending the nursing science? So, the middle range theory of chronic illness is based off of the grand theory of Orem self-care deficit nursing theory. Barbara Regal's theory, the middle range theory, focuses on self-care and self-management as a form of self-caring for chronic illness. Similarly, the grand theory broadly focuses on nurses promoting self-care as a method for maintaining health and well-being. And here's our list of references that we used. Thank you.